It has had a profound effect on cleaning up our workflow and rationalizing our care, and really has been a fundamental team-building tool, as well as forcing legislation and privacy issues that have perhaps obstructed the coherent flow of patient information. So it has been a foundational tool to help us reform the healthcare service in the Northwest Territories. So we actually have an EMR workflow committee, which is a multidisciplinary committee with physicians, nurse practitioners, clinic assistants, administrators, public health, home care, and we are working on standardizing our use of the EMR as a collective, and it's been very important. So the standardization of the use of the EMR is central to its effective function. Every single prescription now by our staff, which is all the physicians, all the general practitioners in the region, in the Yellowknife region and the outlying area that we serve, are prescribing on this one tool. And so consequently we have a longitudinal record of every drug that's being given. Now that's just one tiny example. We now get our labs back in about 6 hours or 10 hours. We used to take about a week to get them back. We get them back. I see those results in my inbox. I may be in a remote community. I can phone the patient and say, you've been diagnosed with diabetes. And then I email them all the patient information on diabetes. And they can read through it all. And I book them an appointment. And I can do that all from the phone. I don't need to see them. And then I book them in 3 weeks to come in, and meanwhile they've informed themselves completely about the illness, about weight management, exercise, diet, and so forth. And I find people are coming in exceedingly well prepared. One of the biggest challenges is people need time to change. Even if you're a proponent of the EMR, the first while you're using it, it feels very bizarre and odd, but you'll never want to go back. You can provide better care in a more timely fashion. Absolutely not. And I think we're just beginning now, after much of the foundational work that we have done, to see the huge benefit of the EMR, which will serve as, which can, if properly implemented, serve as the backbone of a territorial communication system for the management of healthcare. And it can do this in a very robust way, because fundamentally healthcare is a communication industry. For the most part, we don't do much to people. We provide them information. And if you provide effective information in a timely way, that improves outcomes.